Risk factors for diabetes. Over the next few minutes, you're going to learn about the factors other than obesity that increase your risk for type 2 diabetes. Type 2 diabetes is becoming more and more common in most countries as obesity also becomes more common. And there's definitely a correlation between diabetes and obesity. Yes, obesity and type 2 diabetes are related. But some people get diabetes without being what is considered medically obese. And some people become obese without getting diabetes. So what gives? What are the other risk factors that you need to be aware of in the fight to avoid or control your diabetes? Risk factor 1, poor diet. We have an organ in our body called the pancreas. Its job is to release a peptide hormone called insulin in order to help your body break down the sugars that it uses for fuel. Type 2 diabetes is caused when your body becomes resistant to insulin or when your pancreas doesn't produce enough insulin to meet your body's needs to break down the sugars. In either case, it's often caused by a diet that is consistently high in sugars, especially processed sugars. You know, like those that come from soft drinks, sweets, and some baked goods. That is why type 2 diabetes is often contributed to being overweight. Risk factor 2, no to low physical activity. Because physical activity causes your body to use energy, it lowers your blood sugar. Conversely, a lack of physical activity can contribute to the consistently high blood sugar that can cause diabetes. Physical activity is important for everybody and for many reasons. But if you have other risk factors that make you more likely to get type 2 diabetes, you may want to push yourself a little harder in order to stay active. It truly pays dividends for the diabetic person to begin a simple walking program. Risk factor number 3, genetics. Unfortunately, too much sugar and not enough exercise aren't the only things that can cause type 2 diabetes. There is also a genetic component. This means that if you have relatives or siblings who have type 2 diabetes, you might be more likely to get it. The genetic predisposition for type 2 diabetes is also more common among certain ethnic groups, including Native Americans, African Americans, Asian Americans and Pacific Islanders, and Latino Americans. Men are also more likely than women to get it. Yes, type 2 diabetes is genetic, but it is also brought on by a sedentary lifestyle and poor diet. Because families often have similar lifestyles, it can be difficult to tell whether type 2 diabetes is a family member, is a social or a genetic indicator. Risk factor 4, age. Type 2 diabetes used to be called adult onset diabetes to separate it from type 1 diabetes. Type 1 is caused by different things and is usually diagnosed in infancy or early childhood. Although type 2 diabetes is increasingly being diagnosed in children due to poor diet and low physical activity, it is still most often diagnosed in adults. Most people diagnosed with type 2 diabetes are diagnosed after the age of 45. This is partially because after middle age, most of us begin to decrease our levels of physical activity. And as we mentioned above, this leads to higher blood sugar, which can make type 2 diabetes more common. Advanced age also brings its own medical complications that may make the disease more likely. While you can't turn back time, you can continue to make the onset of type 2 diabetes less likely or less severe in your old age. It's as simple as maintaining a healthy diet and staying as active as possible for as long as possible. So, in conclusion, it's true that type 2 diabetes is most common in overweight and underactive people. Unfortunately, this casts the disease as a strictly social disease that no one would ever have if they simply had the willpower to eat better and move more. While these lifestyle changes are important for preventing or managing type 2 diabetes, it is also important to understand that people understand the risk factors for type 2 diabetes that people can't change. You can and should try to eat well and move often to lower your chance of becoming diabetic. But your biological age, your sex, family history, and ethnicity are risk factors that you just need to live with. Control the factors you can control and don't sweat the rest. Thank you for watching our video today. If you liked it, please hit the subscribe button and you'll receive more like it in the future. Thank you.